First thing we have to do is make sure we get some glucose in this animal. Typically, the way they do that is with 50% glucose or dextrose given IV. In that higher concentration, it predisposes this animal to first a transient hyperglycemia and next a rebound hypoglycemia. So just giving that glucose is not going to get it unless it's a very, very mild case. We have to support that to try to keep this animal in a hyperglycemic state longer. The way in which we do that is steroids. All right? Steroids will prolong that hyperglycemic state, all right, for several days. Okay. Next, we know that we need we need propionate. I guess I skipped over the metabolic part, but y'all know the bottles of fatty acids and all that. I don't need to do that, right? You said yes. All right. So, we need a source of propionate. If you don't remember anything else, remember, propionic acid is the most gluconeogenic. All right, goes toward the formation of glucose in the liver. Butyric acid is the most ketogenic. Goes toward the production of ketones. Ketones are only a problem when their production exceeds their utilization. And the fact that they cannot be used by the liver for an energy source. So, back to our treatment. We put glucose in the system, gave this animal steroids, right, to prolong that hypoglycemic state. All right, we're providing a source of propionic acid so it can go through the liver and produce glucose on its own. That is propylene glycol that we give orally. All right. Next, we want to make sure this animal is on a good, high-energy diet. Okay. A couple things that can be added. Insulin is one in very severe cases. All right, helps mobilize things out of the liver, fat and stuff out of the liver. And two, we can use ionophores. Typical example is Monensin. It can be used as part of the treatment as well as preventative. Remember, Monensin does two things. Ionophores do two things. One, kill horses. All right, cardiotoxic. And two, selectively move the gut, change the gut flora selectively to produce more propionic acid. Right? Because usually in production and breakdown in the gut, usually acetate is like 70%, propionic acid is 20%, butyric acid is 10%. Well, when you're using the ionophores, like I said, which Monensin is one of the most common ones, it increases that fraction of propionic acid above 20% selectively. Okay? That's how we're going to treat it. If you've got somebody that only just runs the glucose in there and goes on about their business, you still have that animal set up for possible transient hyperglycemia and rebound. So you have to treat this animal completely, all right, until it is taken in what it needs to take in. Now, on the dairy, we feed animals according to their function. All right, if they're on the milking line and producing a lot of milk, they need lots of energy. If they're on the dry lot, in other words, they've been pulled off the milking line, then their diet does not need to be that heavy in energy. because it leads to obese animals. All right, with fat being stored in the tissues as well as in the liver. When they end up having a negative energy balance moment, the liver is dysfunctional because of all that fat. Hence, fat cow syndrome or fatty liver syndrome. All right, so we need to feed according to function. You go to somebody's farm and they have skinny cows, and they have cows that look normal, and they have real fat cows. It's like, well, why do we have three different conditions in terms of the animal? Well, the skinny cows have active ketosis. All right? When their milk production goes down or their energy drain goes down enough so that what they're taking in can keep up, then they'll go back to looking normal until they put out enough production and utilize enough energy that they go into that negative energy balance again. So while they're going through the acute disease, skinny, loss of condition, all that kind of good stuff. All right? Come back to normal. Those cows that are obese is because they were fed improperly, all right, when they were on the dry line. Okay, when they've been pulled off their milking line. Disease most commonly happens right after parturition because the amount of energy it takes to put out all that milk usually exceeds its dietary intake. So in dairy animals, you expect them to be going through a phase of negative energy balance. Okay, it may be subclinical. If you're feeding properly, it may be subclinical. But basically, they're putting out more than they're really taking in. As long as that balance is not too bad, they'll be subclinical. Okay. Now, that other form of nervous ketosis resembles rabies. It also can resemble grass tetany. In other words, they have severe neurologic signs. Don't need to go through all of them, you know where they are. All right? How are we going to differentiate it from grass tetany and rabies? Grass tetany, history. Okay, it's going to kind of tell you. All right, and the fact that with ketosis, we got ketones on the breath and all that kind of thing. How do we diagnostically check about an animal having ketosis? We can check for VHBs or hydroxybutyric acid in blood, urine, or milk. We have normal levels of VHBs in the blood. We have normal levels of VHBs in the urine. We are supposed to only have trace amounts in the milk. So anything other than trace, if you have moderate levels of ketones in the milk, that means you have a problem. You can have moderate levels of ketones in the blood and urine. If you got it in the milk, you have a problem. So stall side, you can check blood and urine and the levels of VHBs to let you know ahead of time whether you need to alter how you feed and that type of thing, or treat or whatever. All right, in terms of your prevention. Let's see, what else is there with that? Ask what?
So I have in my notes that
You lied.
that type 2 is where there's another disease that causes anorexia, and therefore they're
Type 2 ketosis is fatty liver syndrome.
okay. So secondary is still type 1, just secondary.
Yes.
Okay. Okay. 'Cause-
Yes. Yeah, I know, it's confusing. That's why I made that chart, because it confused the hell out of me. All right. I have it on good authority that on the next test, there's not going to be a whole lot of, oh, is it type 1, is it type 2, is it this? I just kind of heard it, but that won't be on it. Okay? Things like diagnosis and treatment and prevention and that's pretty much gonna be on there. Heavy. Okay. I promise I will not ask any full regimens of treatment, like asking about ulcers, things that are so wrapped up. All right, because I finally have to, accept defeat. I can't create another one. All right, reading through those, and some of y'all got like Martian handwriting. Huh? Hey, not pretty. So remember to mark you down on your test. Alright, that's pretty crap. Alright, so probably won't ask any, maybe one, but that's about it. It's gonna be like rapid correcting. Alright, it's gonna be multiple choice. Okay, so moving on, let's see. Fatty liver syndrome, we know what the deal is with that. You're gonna try to treat it. A lot of times it's associated with other diseases like metritis, mastitis, LDAs, things like that to set these animals off with periods of anorexia and put them into that negative energy balance so that you can find out, oh, my liver's not working well enough to give me the glucose I need. Okay, let's see. All right, pregnancy toxemia. Pregnancy toxemia is ketosis. This has a different name because the energy drain is not milk production, but baby production. That's all it is. It happens 4 to 6 weeks before parturition versus right after parturition. All right, occurs in beef cattle, more commonly seen in small ruminants. In small ruminants, pregnancy toxemia or this particular form of ketosis, all right, is more severe clinically. It is also more refractory to treatment. These animals show more of a combination of neurologic signs as well as like digestive or wasting form. It's like a combination of the two. Because these animals wander away from the herd, they appear blind, ataxic, stargazing, all right, stumbling around, finally going to sternal recumbency, and quickly progress into lateral and then death. All right, without treatment. Treatment is going to be treatment that you give any animal that has ketosis. They either respond or they don't. It is still ketosis. It's another name because of different energy drain. That's all. And it occurs at a different time, 4 to 6 weeks before parturition. Okay. Those animals that have multiple fetuses, those animals that are obese, so they have a lot of intra-abdominal fat, those animals that have a single really, really large fetus, okay, are prone toward this disease. Like I said, treatment is still going to be that protocol that you use for ketosis, because it is still ketosis. Okay, I can't really think of anything else to add to that. Okay, hypocalcemia. Remember, hypocalcemia happens around the same time, most of the time, as ketosis. So when you're doing your physical and you're evaluating an animal, all right, remember you can have the two of them happen either differentials of each other or possibly concurrently. We expect to have hypocalcemia somewhere within 48 hours of parturition. And we're talking about ruminants. Remember, equines, it's not associated with parturition. Ruminants, it usually is. The exception for ruminants about being associated with parturition is those animals that are left on the milking line too long. So a lot of calcium is going out from milk, as well as a lot of calcium is going out for that last burst of fetal development. But majority of the time, within 48 hours of parturition. Okay. Afebrile, non-infectious. It is a calcium deficiency. Lends toward flaccid paralysis in the end. All right, clinical picture. Standing, sternal recumbency, lateral recumbency. All right, when they're standing, they show fine muscle tremors in the flanks, shoulders, anorexia. All right, they have dilated pupils, absent or diminished pupillary light reflexes. All right, so ataxia, fine muscle tremors, all right, dilated pupils. Once they go down in the sternum, dry muzzle, subnormal temperatures to the extremities, cessation of defecation and urination, severe anorexia, all the above. Okay. Lateral recumbency, here moving toward flaccid paralysis, all right, and respiratory arrest. All right, the treatment on them is going to be, obviously, is going to be calcium gluconate. All right, usually given IV. They do have high calcium gels that you can give orally. Usually the treatment regimen is give it IV, all right, so they become basically asymptomatic, and give them the gel to sustain them after the fact. Okay. Remember, calcium gluconate or any calcium-containing fluid, all right, with too rapid an influx into the body can cause secondary heart block. So it can be cardiotoxic. So we have to be careful about the rate in which we give it. How are we going to know when we're giving it too fast? If we're auscultating this animal like we're supposed to and monitoring the heart rate, we have cardiac dysrhythmias, bradycardia, are associated with giving it too rapidly. Now, somebody was telling me about some question on the NAVLE, and they were going for the progression of cardiac dysrhythmias or change in rate. And initially, the animals have a tachycardia, and then after, when it goes for a particular this, they go into a bradycardia. All right, so initially when you start treatment, they have a tachycardia. Well, all of us, if somebody's treating you for something, at first, your heart rate's gonna go up, obviously, because you're being treated medically, so you're freaking out. If you're a cow, you're not gonna be happy. All right? If I'm giving this stuff too fast, it will progress into a bradycardia. Okay? With that severe cardiac dysrhythmia. So the idea is auscultate. So you know it's not going in too fast. All right? You will know if it's working when they start voiding large quantities of urine. But remember, like I said, this is one of those conditions, there are only a couple of them, that it affects the pupillary light reflexes. Dilated pupils, absent or delayed pupillary light reflexes. All right, now, equines. Equines, it's hypocalcemic tetany, eclampsia, or stress tetany. is more associated with stress than it is with parturition. All right, things like weaning that baby off the mare, things like long transport, stuff like that usually sets these animals off. Right? They're not moving toward flaccid paralysis, muscle tremors toward flaccid paralysis. They are more tetanic tremors and spasms. So the most common differential for this is tetanus. All right, these animals show tetanic spasms. They show sardonic grin. They show stiff, stilted gait. They show ataxia. Puberine light reflexes are normal. They stop urinating and defecating. But this thing looks a lot like tetanus. All right, they can have synchronous diaphragmatic flutter or thumps. Right, so it looks a lot like tetanus. Different syndrome than what you have in ruminants. All right, it is still hypocalcemia. The treatment is still the same. Equines are much more sensitive, all right, to the influx of calcium into the system, so you have to be more careful about your rate. They respond pretty much the same way cattle do, voiding large volumes of urine when they're responding. Prevention is not putting mares that are either late pregnant or just have had a